Another risk factor contributing to work injuries is contact stress. Contact stress occurs from occasional, repeated, or continuous contact between body tissue and a hard or sharp object. This contact may create pressure over the affected area of the body that can inhibit blood flow and limit tendon and muscle movement or nerve function. Examples of contact stress may include resting wrists or forearms on the sharp edge of a work surface, pressing handles of tools into the palms, or sitting without adequate space for the knees. Contact stress often occurs when an employee rests forearms against the edge of a desk for an extended period of time. One way to eliminate contact stress in this situation is to adjust the height of the worker or desktop so that the hands, wrists, and forearms hover or float above the work area, or, as an alternative, provide a wrist rest to cushion the surface area where contact occurs. Some might assume that because sedentary work does not require heavy lifting or carrying, it must be less physically demanding and at a lower risk for injury. However, many sedentary jobs are considered to be a high risk for musculoskeletal disorders, cumulative trauma disorders, or repetitive motion injuries. Workers in sedentary positions often sit for long periods of time while performing repetitive motion tasks with their hands, with little opportunity for rest or a break in activity. These highly repetitive positions lead to various cumulative trauma disorders, which account for roughly 3.5% of overall workers' compensation costs in the United States, or a total of $1.83 billion. Office occupations which require continuous computer use can lead to hand, wrist, or arm injuries due to excessive or incorrect keyboarding. Employees in these positions may also develop back problems as a result of extended sitting, which may be coupled with poor sitting posture. Eye strain can also result from long-term computer use and can be complicated by conditions of poor lighting or glare on computer screens. Although office positions are classified as sedentary positions, because they have minimal demand for standing, walking, lifting, or carrying, these positions often require a different type of exertion and can lead to a different type of injury, referred to as a cumulative trauma disorder or a repetitive motion injury. Common problems associated with sedentary work include low back pain, neck pain, tendinitis, carpal tunnel syndrome, visual fatigue, and stress. These injuries do not typically occur with one observable incident. Frequently, the worker dismisses their aches and pains until symptoms have become chronic or severe. At that point, the condition is considered to be a cumulative trauma disorder, one of the most difficult occupational injury claims to resolve.